Hi, my name is Dr. Alif Musaji, also known as the Smiling Dentist, and today I want to talk to you about a topic called clinical compromise. So what's clinical compromise? First of all, let me start with what it's not. Clinical compromise is not doing crap treatment and then saying to the patient, it was a compromise. What clinical compromise is something that actually I wasn't taught that much as a younger dentist. I really want to convey this to you. I believe that patients think that when they come to see us and have treatment done, that they are going to leave with something better than they started with. Now, if it's a diseased or a compromised tooth, then that is definitely the truth. But for patients to leave feeling that our interventions leave them with something as good as a natural tooth that was God-given, if you like, or what they were born with, then I don't think that that's appropriate. So making sure that patients understand the limitations of what we are able to achieve with the dentistry that we do, whether it be an aesthetic compromise or a compromise of longevity, we must communicate that well in the consultation process so that patients are not misled and, I suppose, set themselves up for expecting more than we know that we can deliver as a profession. A classic example of a clinical compromise is that of three competing forces, if you like. There is a desire to do work that is beautifully aesthetic and makes the teeth look natural when they're done. There is a desire for teeth and treatment to be long-lasting, and there is of course a desire for our treatment to be conservative, for us not to remove more tooth structure than we need. But what we know is that often these three elements compete, and in restorations where we have been super conservative in our preparation, sometimes we are unable to provide the most beautiful and aesthetic restorations, or maybe because we prepare less, the restorative material is thinner, and then we end up with something that's weaker and maybe won't last as long. And will not perform as well when needing to overcome the kind of masticatory forces that a mouth can provide. So it's really important for us to understand well what it is that our patient wants from us so that we can deliver best. I can give you an example of a patient that came to our practice, and for this particular patient, a dentist saw them for a consultation and wanted to give them, predominantly the patient wanted to have tooth whitening, and they wanted to have Invisalign and then some tooth bonding as well. Now, as is often the case, the patient will be fully assessed, and then a note will be made that some of the teeth, perhaps at the back of the mouth, are wanting in terms of improving fillings for health reasons. So there was a particular amalgam filling that had leaked and the tooth had become very dark. So if this patient has come to us for cosmetic treatment, what had happened was the leakage had caused much of the tooth to become grey and dark. Now, when the amalgam restoration was removed, it was deemed that the surrounding tooth tissue was caries-free. And so, thinking from the point of conservation, less tooth was removed and a tooth-colored restoration was placed, but the tooth was left looking grey and dark. Now, it's not a surprise that the patient came back to us afterwards and said, look, my filling has been done, but my tooth still looks black. Why is that? This is not what I wanted. And really, an error was made at the consultation phase because one should have explained that there are two ways to particularly treat this tooth. One would be the super conservative method of removing just the filling and the small caries that was there and placing a filling. The other option would be to remove more tooth structure which from the point of view of conservation, of course, is not the right thing to do. But from the point of view, the competing view of aesthetics, of course, the only way to improve the look of this stained, affected dentine is to remove and to place a tooth colored restoration, a bigger one, so that the tooth looks good at the end. The important thing to understand is that there is no right or wrong way. The way is the one that helps the patient, the way that fulfills the patient's desires, so that they leave happy and they also leave understanding that by removing more tooth, that perhaps the longevity of that filling will be compromised and that they may need to have a crown sooner. Now, as long as the patient understands and is completely on board with the treatment, the advantages and the disadvantages, then I feel like the consent process has been done well. I often say to patients that there is no perfect dentistry. There's no perfect option for them to take. The option that we should go for is the one where the compromise that that particular option brings suits them best. As soon as they understand that paradigm and they are on board, then I feel that's a patient who understands really what we can achieve as dentists. And I think normally that's a very safe patient to treat without exposing oneself to problems later. I hope you enjoyed our video today, and I hope you'll join me for more in the future. Please don't forget to like, subscribe and share. And I'll see you soon.